Welcome back. Mike Spence, TSPN TV News Desk, and I'm here with Anne Platt, CEO of Amador Sutter Amador Hospital. I always have to get a mouthful going with the name of the hospital, one of my favorite hospitals, because I did have an experience I always talk about when I first moved to Amador County over 10 years ago, and with a blood clot in my leg, and they saved Dr. Hartman saved my life. So Sutter Amador Hospital, we mentioned earlier, has received that top 10% ranking in that A grade, but I truly believe we have one of the best hospitals we could ever ask for in any local community. I was very surprised with the type of care that I had personally. So I've had personal experience with that. But I know a lot of our viewers and residents throughout the county are mainly concerned with this Affordable Care Act and the idea that care somehow might become diminished, and we might, because of this act, and it might change things so dramatically that the level of care would be diminished. Do you think that might happen? Do you see that happening?
Well, I certainly hope it doesn't, Mike, and I'm glad to hear that you've had a good experience at the hospital. We are there 24 hours a day, 7 days a week for our community and our neighbors and our friends, and we want to meet the healthcare needs. That's our mission, is to meet the healthcare needs of our community. Again, you are aware that there's a lot of unknowns about how this act will actually be implemented. There's still controversy around it. There are still folks who would like to see it overturned. We're pretty far down the road now. I'm not anticipating that will happen. One of the provisions is access for everyone who currently does not have coverage. That, we anticipate, is going to put more pressure on the provider base. So as we look at how many physicians, nurse practitioners, physician assistants do we have available in the community to meet the population needs, it's going to be a challenge, I think.
That's what people are afraid of.
Yeah.
Generally, are there going to be enough doctors and nurses to meet those needs?
To meet those needs. Well, as Sutter, we have a branch of Sutter that operates physician practices. So, for example, we have 3 family practice offices in the county, one in Plymouth, one in Jackson, and one in Pioneer. Recently, we had to temporarily close the office in Pioneer because we didn't have a physician. The physician who had been there for many years decided he wanted to pursue other opportunities, and we've been recruiting, and I'm happy to say we successfully recruited a new doctor. Dr. Donahue will start, I hope, in October. We have another
I've never clapped before on the news desk, but
isn't that great?
That is a great development.
And I think she's really going to, be a wonderful addition to the community. We also have a new doctor starting in Jackson before the end of the year, and that will give us more access than we have today. We monitor access on an annual basis, on a routine basis if something changes, and Sutter will commit to trying our best to maintain the level of access that we need. Right now, we're a little behind the 8 ball, so I think in a few months we'll be in better shape.
Right.
And then looking out in the future, we have a lot of physicians who in the next 10 years will likely retire. So it's going to be a challenge because medical schools, residency programs do not have enough slots even to cover all the medical student graduates. So there's going to need to be a creative innovation in how we provide access. And we may see the use of more nurse practitioners in a primary care clinic to provide access. In fact, there's a bill right now in the state looking at trying to give nurse practitioners a little more independent so that they will be able to provide more access.
Your doctor is now the primary doctor who you have normally. They don't follow you anymore into the hospital. If you end up in the hospital, do most of them now just turn you over to the hospitalist program that you have now going?
Not all of them. There are still some private physicians in the community who choose to follow their patients in the hospital, and that's fine with us, and we welcome them. There are other physicians who have decided it makes more sense for them to let the hospitalists in the hospital take care of their patients when they do need to be in the hospital. And then when they leave, they go back to the physician in the outpatient office setting.
That's been a big change, and most doctors, I think, in the future from what I can see, it'll be very difficult to have a little office out there on the highway, with all that staffing and all that insurance cost. I think most of them would have to move into a hospital setting. It seems like more and more doctors are getting into that hospital setting, and with things changing with the Affordable Care Act, I think that would even push them even further toward.
I think a lot of doctors want to be in a group where they have more administrative support to take care of those more complicated support services like purchasing, like electronic health records, billing. Billing is very complicated in healthcare when you have so many different insurance companies with different rates and different rules and regulations, and the job of your biller coder in any setting, whether you're in a physician office or the hospital, has become much more difficult, and it requires more education and much more attention than it did, say, back in the old days.
Well, as the Chief Executive Officer, you're probably overseeing the new billing program that's going to be implemented at the hospital. What is the cost of implementing a program like that to process all that billing electronically now? Did you mention there was a new program coming online?
Sutter Health as a system has consolidated all billing functions into one central service organization now located in Roseville. So previously our billing was done in Sacramento at a region billing office, and now Sutter is consolidating all the region billing offices into one as an efficiency factor to try to make sure people who specialize in certain types of billing are assigned to that billing and saving cost for the whole system, which then can be passed on to our patients.
A major shift, yeah.
Yeah, we really want to reduce the cost. If we can reduce our costs, we can pass the savings on to our patients, which is what patients want.
Well, I know there's another big concern that I've heard in the meetings in terms of Medicare and the type of coverage that people have, where they would be setting up a separate board, a new Medicare board, another government agency, as the way they describe it, of not necessarily medical professionals, but more of the political types that would sit on this board, and people are very concerned that they're putting together another agency that's going to make determinations about spending curbs and what type of coverage is available. And that's been a big concern out there. Have you thought much about that, and when people say that?
I have thought about that. I think initially the scare was that there was some type of a board that was going to determine end-of-life care decisions for Medicare folks, and I really don't see that at all in anything I've looked at. There is an independent board that is being established. I don't know yet the complement of those board members. The messaging that we hear from Medicare is that that board has been established to make sure that any of these changes in the Medicare program are not negatively impacting seniors. Because anytime you make broad, sweeping changes to policy, you sometimes miss some of the things that might slip through the cracks. So if you go on the government website and look about what is the purpose of this board, it is to assure that things are working well, and if there are areas where there need to be corrections, that this board would be able to make those recommendations to make changes. Now, some people will say it's more than that or it's less than that, and so until it's actively in place and we experience some more of the measures of the Act, because some of the Act has already been in place now for a couple of years. Some positive things like your children being able to stay on your health insurance plan until they're 26.
Another round of applause. You're the only guest I've applauded for twice.
Yeah, wow.
Yeah, that's a big plus. The hospital itself and the way that I just had a thought in terms of. Never mind. Go back to you. Keep thinking. I had a thought.
You had a thought in it.
It escaped me, but I think those concerns that people have, and when they do come up with those ideas, they should have a little bit of faith. I mean, you have to understand that this date. Most of the hospitals have been holding off because they thought that the Act may have been overturned, so everybody kind of played the wait-and-see game.
Right.
So now you're trying to get back up to speed very quickly with an impending date that's coming up it's kind of unfair because I think everybody kind of said, wait and see, this may happen,
Yeah.
it may not, and then all of a sudden it's happening, and it's happening very quickly. So it's kind of put people into that unknown
We're not sure
space.
what's going to happen.
Yeah, we have
And
to have a little faith.
Any change is difficult, especially if you don't really understand it, or especially if you don't agree with it.
Right.
So I think, we're going to have to see. Get out the crystal ball. It's a little cloudy right now, but unless, and this act will be changed. I'm sure it will be changed over the years as we understand it better in terms of how does it actually impact the average person. I think there are a lot of provisions in the act that are very beneficial for low and middle income patients. So will they really be, or what about the other population that are not happy about it? How will it impact them? Will they change their mind later? We just don't know. There's so many unknowns about it.
Right. It really is. You hear the issues, and you've been making an incredible presentation. Your presentation is actually about an hour and a half long.
Well, not quite that long.
I apologize to our viewers. We're just kind of abbreviating a lot of it, and you have an incredible way of describing some of the elements because they are very complex, and people have a lot of questions. And, but you do have to have a lot of faith that things are going to work out. And we have a wonderful hospital and a great staff of doctors, and you've been adding surgeons and different staff. I mean, I can't keep up with all the different, medical personnel that you've been adding there at the hospital and making a lot of progress over there. It's just great.
Well, good. We do. We have a wonderful staff at the hospital. They're very dedicated. They're very committed. And it's just a wonderful community to be a part of.
Well, I know you always close your presentation, and we only have a minute left, by thanking people for their partnership in the community and making it so that we have the best hospital imaginable here in the county. And I would just thank them for you because those business partnerships and personal partnerships and donor relationships are incredibly important. The community, really needs to take a part in having a great hospital. And I'm sure that they're doing that. I know you're having all sorts of events, and we'll have to have you on and talk about. You have another big event coming up, and we're going to.
We do.
Yeah, we're going to talk about that big gala event. Everything. There's always something going on there at the hospital. But I want to thank you for coming on today. And it's Anne Platt, CEO of Sutter Amador Hospital, and we've just been discussing the Affordable Care Act. And if you have any questions, you can go right on the website. I'm sure there's all sorts of information. But we're going to have you on as more and more questions come up. And thank you again for coming on.
Well, thank you very much.
Great having you.
Appreciate the opportunity.
You're watching Amador County's #1 news and sports leader, TSPN.